My name is Ron Hoekstra, and I am a retired neonatologist and worked in Minneapolis Children's Hospital for 40 years before retiring, and have had experience with having foreign doctors, primarily Ukrainian, but not all Ukrainian, coming to our unit and spending time with us, along with nurses that work with these doctors in Ukraine.
And how did you specifically get started working with Ukraine?
I had a friend who was an orthopedic surgeon who, after Ukraine freed itself from the Soviet Union, started a joint replacement program in central Ukraine. And he was taking mission trips once or twice a year, and he asked me if I would go along and give some talks and lectures on stabilization and resuscitation of newborn infants. And so I went with him and took a mannequin with me and demonstrated resuscitation and talked about the basics of resuscitation of newborns, and just met a lot of Ukrainian doctors. And after about 5 trips, I became somewhat discouraged because I wasn't seeing any changes resulting from lectures. I don't know why I was surprised, because I'm not a good lecturer, but anyway, I wasn't seeing the changes that I had hoped to see. And it also was apparent to me that there was very little communication and collaboration between doctors and nurses, and it seemed like they weren't all on the same team. So rather than continuing to make these trips to Ukraine, I decided to bring teams of 4 people, 2 doctors and 2 nurses, to Minneapolis for a week and to spend time with me in the NICU. And I took a week when I was not on service. In other words, I wasn't doing a normal amount of work, and I was freed up to spend time with these teams, doctors and nurses. So what we would do is we put the doctors and nurses in rooms next to each other in a hotel that was 2 blocks from the hospital. We thought it would be a good start at having them become friends and talking to each other, even if it wasn't about medicine. So they got up in the morning. I picked them up at 8 o'clock in the morning, and then they were in the hospital until 6 p.m. every night, and they did no sightseeing when they were there. They were there to learn. And they went to all of the high-risk deliveries for a week. The nurses, we paired with our top nurses. And what we wanted the nurses to learn is that they had an extremely important role in the team concept of delivering care to sick and premature newborns. We always considered the nurses to be our eyes and our ears, and even though we would spend 10 to 15 minutes at the bedside in the morning for rounding, we depended on the nurses to detect the subtle changes that would occur in these babies and to come and notify us. And in order to do that, the nurses had to have some knowledge of the physiology of the newborn. And we emphasized to the doctors that if their nurses did not know the physiology of the baby they were taking care of, then the doctor would have to stop and teach them the physiology at the bedside. And so the nurses spent a lot of time with these top nurses in our unit, but they did break away and go to all of the high-risk deliveries also. And we kept them busy all day, and we at night, instead of going to a fancy restaurant, we would take them to the homes of some of my friends, people who I consider to be the ultimate in a Christian family with a wonderful home. And so they could really see what an American home was like. And I think that this became kind of a highlight for them. And for my friends, it was really a highlight. So at any rate, we did this with 4 teams. We started off with a couple of teams from Kyiv in Ukraine, and then we had a team from Poltava, we had a team from Kharkiv, and then our last team was from Ivano-Frankivsk in Ukraine. And when the teams, we got this all started, I should add that this is at the time in 2012, things started where Ukraine was going to reform their health care, and they decided to start with mothers and babies. And so the program in Ukraine was financed by an oligarch, and he bought tons of equipment, expensive equipment. So these units that we went to owned the same equipment that we had at Children's Hospital in Minneapolis, but they didn't know how to use it. And so they came over and saw us using it, and really they were like sponges. They really learned quickly. They're so smart. And so anyway, after all of these teams had been to Minneapolis, in 2015, I got on a train with a lead obstetrician from Ukraine who helped pick all of the people that came to Minneapolis. And we started in Kyiv and went to Kharkiv and then to Poltava and back to Kyiv and then to Ivano-Frankivsk to see how the people who had been to our unit were doing. And we were truly amazed. We could not believe the kinds of success they were having and the things that they were doing. Not only were they having great success, but all of the units had remodeled their units to be like the one that we have in Minneapolis. And so the construction was all fairly new. We have in Minneapolis, we have a follow-up clinic where we see the graduates of these programs between 6 months following discharge up until they're 5 years old. And so at the last point of the visit in Minneapolis, we would take the Ukrainians to our follow-up clinic for a day to see what happens to these babies that weigh as much as or as little as 11 ounces when they're born. And this is when they really got the picture that this was not something that was humanly possible, and this would be a miracle that had to involve God. And this gave us a chance to, all along we would do this during the week, but to tell them the importance of faith in their practice of neonatology. And we had a habit of telling people when we would go to a delivery and resuscitate their baby and get the baby tucked into the NICU, we would always say, we have every instrument, every machine on the face of the planet to take care of your baby, but you must know that the baby's ultimate outcome is in God's hands. And the NICU turned into a mission field because a lot of people didn't really get it. What's this faith business? But at any rate, it was really, it was an eye-opener to Ukrainians. They didn't know about this. And I am hoping and praying that along the way that some seeds have been sown and that we will see these wonderful friends that we made in heaven someday. And I think that this was a program that was the highlight of my 40-year career at Children's Hospital in Minneapolis. And I met Rosti when Rosti was just a little more than a teenager, getting out of medical school, and he and I have been friends for the last 25 years, and he had the opportunity to see some of these teams that came to Minneapolis, and then he got the idea that, well, we can do this with all kinds of specialties, oncology, transplantation, and so on. And so I'm excited to go and see what's happening with the things he's doing now. And so it's been a real privilege.
So you focused on neonatal health. When you went to Ukraine a year or so later after having your teams come visit here, did you see your practices being adapted by other departments within the hospital, the doctor-nurse interaction, or were you able to see any of that?
Well, our doctor-nurse interaction started from the beginning because we realized that as doctors, without the nurses, we couldn't do anything. I mean, the nurses were our eyes and our ears, and so we worked with the nurses from the beginning, but when we went back to visit the Ukrainians, it was amazing how much the nurses loved their jobs and how excited they were to show us all the things they could do now that they never, they used to change diapers and that was it. But now they were, doing all kinds of things, and they had, job satisfaction. They loved what they were doing. It wasn't a job, it was a passion for them. And so that was exciting to see. As to the rest of our hospital, we never got out of the NICU, so I don't know what the rest of our hospital, I would guess that, the nursing is so much different in the U.S. than at least it was in neonatology in Ukraine. But I can't speak to the nursing in the rest of the specialties in Ukraine. But the team concept is something that we tried to emphasize during the time that these people were with us. And the team didn't stop with the doctors and the nurses, but we have what we call health unit coordinators. That's actually the secretary that sits at the front desk and greets people when they come in. And we would tell them, you only have one chance to make the first impression. And so we hired people who were obviously dynamic personalities to do this job. And the job involved not just smiling and things like that, but answering the phone, knowing exactly what's happening in the NICU, who's in surgery, who's coming back from surgery, where the doctors are. And we never allowed, if you can believe this, you probably don't, we never allowed them to put anybody on hold on the phone in 40 years. No punch this, punch that, So anyway, that person that sits at the front desk is a vital member of the team. And, we had tremendous respect for them. And as a result of them knowing how important it was to us, they loved their jobs also. I think that there's a lot to be said for feeling valued. And I think that those people did feel valued. And, even environmental services, I call them cleaning ladies, but they are extremely important, because if you walk into an NICU and it's not spotless, the people are not going to feel real good about having a baby that weighs less than a pound being cared for in that environment. So we had a team of, mostly African American ladies who were absolutely angels, and they were the cleaning people, and they kept it spotless. And they not only were cleaning people, but they were encouragers. They got to know all the families, and they became fast friends with the families, and they were our encouraging team. So there's a lot to be, a lot of people with important jobs that are over or underappreciated, but they should be overvalued.
This is a side question. You mentioned bringing a mannequin. How large was the mannequin you brought to show how to resuscitate a premature baby?
Well, this was a mannequin that was the size of a full-term baby. And we were trying to demonstrate things like intubation and resuscitation and so on. Just a kind of a funny sidelight to that. When I got to customs in Kyiv and they opened the suitcase, they were a little scared. They thought it was so lifelike that it was real. And I had some explaining to do.
That's awesome.
Let's see, you've mentioned a couple times that the physicians you've met from Ukraine, when you were over there, in fact, they all seem very young, but they're also very smart.
They are very smart.
So do you feel they have a proper medical foundation? They're just sponges looking to absorb more from
I think they
trips
are
like this?
well educated. They are well educated. They understand physiology, and the thing is that you can't teach the things in a lecture that they saw when they came over, and that would apply to any specialty. They need to see it and see how it's done, and to see how all of the parts work together. And you can talk till you're blue in the face about the team concept, but they aren't going to get it until they see it working. I think that one of the just examples, and I'm sorry to be rambling here, but one of the examples is that last night one of our teams was there. We had to go to a delivery at 5:30, so we were going to be late for dinner where we were going, but we went to this delivery of 24-week twins, and we were in the resuscitation room, and the usual thing for us in our practice is the doctors would intubate the babies, and nurses, the nurse clinicians would put in the lines and everything, and everybody knew their job. And when we got out of the delivery room, the Ukrainians said, "Nobody said anything." And I said, that's because they all know what to do, and they know what their part is in the resuscitation. So those are examples of things that you can't teach unless people see it.
One more question for you. I read a wonderful article from People magazine of 2009 highlighting some of the work you've done and some of the babies that you saved that grew up to thrive in life. Do you keep up with a lot of your premature babies?
Yeah, well, first of all, I don't save them, God does, and I don't take any credit because I can't believe it myself that they survive. But I do keep up. Christmas is always fun because I get a lot of Christmas cards from the parents. And obviously, during the time that we were there, we participated in the care of 40,000 babies. So, but there are some that we'll never forget, and those are the ones that I do keep up with. And I've seen some of them get married. I've seen some of them graduate from college. We looked at a group of 23 to 26 weekers when they turned 19 years of age, and 70% had graduated, 80% had graduated from high school, and 70% were in post-high school graduate, whether it be a trade school or college.